Hello friends, a very warm welcome to my lecture. Today we are going to discuss a very important topic named as warm chain. Now what exactly is warm chain and why do we study this? First of all, this is very important from the point of view of your professional examination. It can be asked as a short note or hypothermia in newborn can be asked as a long question also. And definitely it is very important from the Viva point of view. So what exactly is warm chain? So it's a series of events, series of procedures and techniques which is important to follow in order to keep a newborn from getting into hypothermia. You must remember that there is another thing, another topic we'll study in pediatrics, that is cold chain. Cold chain we study in vaccination. Right, so do not confuse with the cold chain. Here we are discussing about warm chain. So these are the 10 components of the warm chain. Please pay attention. I'm going to discuss about every single one in detail. And I would like that you memorize it and you understand it with a lot of understanding and conceptual point of view. But let me tell you that at the end of the lecture, I'm going to give you a mnemonic which will help you remember these headings. So please stay till end. So what are the components of warm chain? This is, first one is warm delivery room, then warm resuscitation. Third is immediate drying, then giving skin to skin contact to the newborn with mother. Early initiation of breastfeeding, postponing weighing in, bathing of the baby, proper and appropriate clothing, rooming in and bedding in, warm transportation, whenever required, warm transportation. And last but not the least, training of the staff. So we'll discuss these one by one. Coming to warm delivery room. So whenever the baby is getting delivered, delivery can happen in where? Labor room, right? It can happen in the labor room if the normal delivery is happening, or in the oxygen theater if the cesarean section is happening. So whether it is labor room or OT, temperature of the labor room of the OT, that is delivery room, should be 25 degrees centigrade to 28 degrees centigrade. Right? This is the optimum temperature. What can we do if the temperature is too cold? We can use room heaters. We can use room heaters, we can switch off the ACs, etc. Other thing is, the area should be draught free. What do you mean by draught free? That air circulation should be minimal, right? So, draught free करने के लिए what can we do? First of all, we have to close all the doors and windows. Always close doors and windows, and then we can switch off AC and fan and what other appliances in there is source of air. So we all know that why it is important. Temperature तो ठीक है, हमारी समझ में आ रहा है कि temperature अगर low होगा तो hypothermia हो सकता है. Why is it important to keep the room draught free? You know, we know that heat loss in a newborn occurs by various methods. So convection is one of the method. Convection. You must have read this in physics. This is basically a concept of physics. Convection में क्या होता है, जो air currents होती हैं, तो whenever the warm air is being replaced by cold air, so this can lead to heat loss in the newborn. So heat loss by air current is convection. When we make the delivery room draught free, we prevent the hypothermia or heat loss by convection, right? Coming to warm resuscitation. Now we should remember that when a baby is being born, the baby is coming from 37 degrees centigrade to 25 degrees centigrade, and that too under ideal conditions, right? So when the baby is inside mother womb, it is at the temperature of 37 degrees Celsius. और इसको इतने low temperature में आना है, तो it must be very stressful thing, right? So we need to give a very warm welcome. One of my teachers used to say that we need to give, whenever a baby is being born, we need to give it a very warm welcome and not the cold welcome. So warm resuscitation का concept यही है कि suppose the baby is being born and in the labor room or in the operation theater, if at the time of birth baby is crying or breathing, that is the baby cries immediately after birth. So now all the NRP recommendations say that we should put the baby on the mother's abdomen. We should not separate the baby from the mother. Immediately we have to put the baby on mother's abdomen and do the initial steps of resuscitation there only, right? So first point, most important, do the resuscitation on mother's abdomen of mother. This could happen only in the case of if the baby is crying. If the baby is crying. Suppose the baby is not crying. Baby is not breathing or apneic or not crying. ये सब हम पढ़ेंगे neonatal resuscitation में, separate topic altogether. So what we need to do, we need to put this baby to warmer, to the resuscitation corner which is there in the delivery room. We'll take the baby to the resuscitation corner, right? Resuscitation corner. Now resuscitation corner में what we can do, we should pre-warm all the things. All the things needed in the resuscitation should be pre-warmed, including linen या जो भी चीज़ें needed है, उसके लिए we use warmers. Warmers should be switched on. Warmers should be switched on 15 to 30 minutes prior to the delivery. 15 to 30 minutes prior to the delivery. Minutes earlier. Warmers should be switched on. And then they should be operated on the manual mode, giving 100% of heat. Always remember this, right? So in case of normal baby, if the baby is crying, we have to put the baby on the mother's abdomen. And if the baby is not crying, we have to take to the baby to the resuscitation corner. वहाँ पे भी हमने चीज़ें resuscitation की warm करके रखना है, right? Coming to drying. Now whether you take the baby on mother's abdomen or you take to the resuscitation corner, next is drying. So we dry the baby with a pre-warm linen or sheet. Remember, pre-warmed linen or sheet should be used. Second, whenever we start drying the baby, we always start from the head to the whole body. Why this is important? Because in a newborn, we all know that in a newborn, surface area of the head is maximum. And surface area, jitna zyada hoga, surface area is the function of heat loss. Whereas the weight of the baby is a function of heat production, right? So smaller the baby, lower the weight, more lower birth weight baby, less production of heat. Larger the surface area, more production of heat loss. More heat loss. So head should be dried first because head is a major source of heat loss. Head to the whole body, and when you are done with the drying, you should get rid of the wet linen. Immediately remove the wet linen. Remove the wet linen. Wet linen should be removed and then cover or wrap the baby with a dry warm linen. Okay. So these are the steps of drying. Suppose what happened, baby was delivered, you put the baby on mother's abdomen, you covered it with a linen, you started drying from the head to the whole body. You got rid of that towel, wet towel, you cover the baby with the dry towel. And now what will you do? You keep the baby on mother's abdomen or in between the chest with skin to skin contact. What is skin to skin contact means? Skin to skin contact means that there is nothing between the skin of mother and baby. Mother should be in direct, as you can see in this picture. Picture is self-explanatory that baby is in direct contact with the mother's skin, And basically you can cover the mother and baby hole, both of them, with a sheet or a blanket depending upon the surrounding temperature, right? So skin to skin contact is a very important method to prevent the hypothermia. Coming to breastfeeding, immediately after drying and putting the baby in between the mother's chest, you can start the breastfeeding. Most of the recommendations now say that the breastfeeding should be started within 1 hour of the birth. Within 1 hour. So this is the recommendation. Early initiation of breastfeeding. It will prevent the hypothermia. So breastfeeding should be started within 1 hour of the birth. Right? Postpone weighing and bathing. Now this is also a very important topic. Very important point. Because weighing, we should not hurry with the weighing of the baby. एक एक करके बात करते हैं weighing और bathing के बारे में. What is the ideal time to weigh a baby? It is 1 hour after the birth. 1 hour after the birth. Recommendation says that baby should be taken to weigh after 1 hour of birth. Why? क्योंकि 1 घंटे में what all you have to do? You have to put the baby on mother's abdomen dry and give the initial steps, and then put the baby into skin to skin contact with the mother, and then initiate the breastfeeding. So after that, when the 1 घंटे में baby का temperature काफी stabilize हो जाता है, after that you can take the baby and you can weigh. Weighing में I would like to point out one thing, that there could be heat loss by conduction. अभी हमने डिलीवरी रूम में पढ़ा था कि हीट लॉस बाई कन्वेक्शन हो सकता है. यहाँ पे वी आर स्टडिंग दैट heat loss by conduction. Whenever the body of the infant comes in contact with a solid surface, direct contact with the surface, then the heat loss by conduction occurs. So we can also put a warm linen over this weighing scale, and then we can weigh the baby. Right? Coming to bathing. What about bathing? Normal full-term babies should be given a sponge bath after 24 hours. After 24 hours, we can give sponge bath to the baby. Meaning, we can take a wet towel, wet cloth, that too in the warm water, a cotton cloth dipped in the warm water, and then we can sponge the baby with it. Right? The traditional water bathing should be postponed till the cord falls off. This is very important point, that the bathing should be postponed. Traditional bathing should be postponed till cord falls off. So this happens somewhere between 10 to 7 days. Right? So for this period of time, you have to wait before you can bathe the baby. Or just sick babies and very low birth weight babies, and definitely they will इतनी जल्दी इनको bathing नहीं कर सकते हैं until unless they are discharged and gain weight of the term baby 40 week of gestation हो जाता है, या 2.5 किलो की हो जाते हैं, 2 किलो की हो जाते हैं, उसके बाद ही we can bathing. This is about this. We talk about only about the full term babies, right? Coming to clothing. Now this is very frequently asked question by parents. अगर कोई आपके पास पेरेंट आता है, हमसे पूछता है कि बच्चे को कपड़े कैसे पहनाने चाहिए, तो your first question should be, you should be clothe your baby in multiple layers. So soft cotton clothing should be there. Soft cotton clothing, and उसके multiple layers. How many layers are sufficient? Usually the number of layers needed by adults plus 1. So if we are comfortable wearing 2 layers of clothing in particular environment, in the particular temperature, then the baby needs 3. If we are comfortable wearing 3, baby needs 4. But we should never clothe a baby in a very heavy woolen clothing, because it can lead to suffocation also. Now one point to remember, that along with 2 layers of clothing, baby should also be worn cap, socks and mittens. Cap, socks and mittens. Initially very important is specifically cap. You can see in this picture the baby is wearing a cotton cap. In all these pictures a cap should be there, right? The baby should be wearing cap all the time. Even during the drying, right after we dry the baby and put the baby in mother to mother contact, we should put a cap and then cover the mother and baby with a linen or bed sheet or the blanket. Okay. Next one is rooming in or bedding in. Now, ज़्यादा इसमें भी कुछ explain करने को नहीं. This is pictures are self-explanatory. You can see here the mother is lying in the bed and the mother is lying in the bed and the baby is lying in a cot. So basically this is rooming in same room but different beds. So this is more common in Western society. In Indian societies, bedding in is more common. That is mother and baby both are in the same bed. Okay. So what is the advantage? Obviously temperature control is better in this one. But some reports say, some research say that bedding in can lead to SIDS, sudden infant death syndrome. Sometimes, if the mother is not very vigilant, then it can lead to SIDS. Otherwise, India में दोनों ही practices आप कर सकते हैं, advise कर सकते हैं. Coming to warm transportation. Now let me tell you, warm transportation is the weakest link in this chain. The weakest link. The area where a newborn is likely to become hypothermic the most. Okay. So first point to remember that it is the weakest link. What all we can do whenever we are transporting a newborn baby, what all we can do to prevent the hypothermia? First of all, skin to skin contact. So if the baby is healthy, and suppose the baby is healthy, baby is feeding well, there is no issue, mother and baby both have to go home. So my mother can take the baby inside the skin to skin contact and then both of them can go, right? So first is skin to skin contact. Second is incubators. So if the baby is, suppose the baby is preterm or low birth weight and need to be transferred to nursery from the delivery room, then incubators should be used. So incubators are closed chambers. You can see an incubator in this picture. These are closed chambers with a temperature control system just like warmers, right? Third is very interesting one. Suppose there is a mother who is at high risk of suppose a mother who goes into preterm delivery. Now she presents to preterm labor. Now she presents to a peripheral hospital, to a primary healthcare center with labor. Now you have two options. Just let me know what option would you choose. First, that you deliver the mother and then transport the mother and baby, the preterm baby, both to the hospital where the neonatal ICU facilities are available, or you refer the mother to get delivered to the hospital where these facilities are already available. What would you choose? Definitely the second one, because आप फिर से वही पूरे ट्रांसपोर्टेशन के में जो हाइपोथर्मिया के चांसेस है उनको अवॉइड कर सकते हो. दिस इज समथिंग कॉल्ड एज इन यूट्रो ट्रांसपोर्टेशन. In utero transportation. So transfer the preterm baby even when he or she in the womb. Because we know inside the womb temperature is 37 degrees Celsius, which is the safest. Last but not the least, training and teaching. Now this is very crucial. We need to teach and train all the healthcare staff, sisters, even the mother and father and other family members. These all, जो भी हमने पढ़ा है, जो भी हमने जाना है, we need to spread this awareness. We also need to tell them the detrimental effects of hypothermia, which can happen with the child if the baby develops hypothermia, so that they become vigilant about it, right? Now coming to the most important thing, which I think you all were waiting for, mnemonic. So I have made this mnemonic. एग्जाम में आपको कुछ नहीं आता है, आपके 10 पॉइंट्स रिकॉल कर लोगे इजिली, तो यू विल बी एबल टू राइट. सो दिस इज ड्रिप सेट फॉर चिल्ड्रेन. ड्रिप सेट फॉर चिल्ड्रेन यू हैव टू रिमेंबर. वी डिटेल में एक बार देख लेते हैं. डी फॉर वार्म डिलीवरी रूम. सो दिस इज डी फॉर डिलीवरी रूम. सेकेंड इज आर. ड्रिप में सेकेंड इज आर. So second is warm resuscitation, and there is another one, rooming in. So resuscitation as well as rooming in. Then the fourth one is immediate drying. Immediate drying. Then the fifth one is postponed bathing and weighing. Postponed weighing and bathing, right? Then the sixth one is skin to skin contact. Skin to skin contact. E for education. E for training and teaching. We can also call it education. Education, right? T for transportation. We read that transportation is the weakest link. Transportation. ड्रिप सेट में टी आप याद रखो. टी इज़ द वीकेस्ट लिंक. ओके. ड्रिप सेट फॉर चिल्ड्रेन, एफ लेंगे हम यहाँ से और सी लेंगे. ठीक है. लास्ट के जो 2 वर्ड्स हैं उनके हम सिर्फ फर्स्ट लेटर्स दे रहे हैं. एफ फॉर फीडिंग और ब्रेस्ट फीडिंग, राइट? फीडिंग और ब्रेस्ट फीडिंग, अर्ली इनिशिएशन ऑफ ब्रेस्ट फीडिंग. एंड द लास्ट बट नॉट द लीस्ट इज क्लोथिंग. I hope this will help you in remembering this.